As part of our planning process, we applied lean process improvement methods into our design, and that helped us as a healthcare ministry identify areas where we can eliminate waste in terms of time, supplies, equipment, and increase patient value and increase the patient experience. So we did a lot of work in the planning process, looking at how we do things now, how we could improve that process if we had better support from the facilities. We did exercises to measure efficiency of current workflows, patterns of how patients, supplies, and information move throughout our organization, and we found we had lots of opportunities to make big improvements. And we're not going to go through all these today, but I want to share one example. This is, I know it's a little difficult to see, but essentially it's the current hospital building, and you can see the 4 floors and numbers and diagrams, and there are 16 different stops, and this represents the movement of a patient who's receiving an outpatient surgical procedure in today's world. And I can comment on this from experience because I went through those 16 steps myself a few months ago as a patient. So there are 4 elevator rides and 16 stops for a day surgery patient. And again, this is because we have an inpatient facility trying to deliver outpatient services. And now on the next slide, I want to show you what we're able to do with this same process, what we'll be able to do in the new facility. And not only will this be a better process for patients, now we're looking at 6 steps, all on the same floor. So it's also less staff traveling and shorter distances to care for patients. We were able to determine by making this in the new facility, reconfiguring how we deliver the services, we can save from 1.5 to 3 miles per day for a nurse transporting patients. And that's just in this outpatient surgical department. So rather than moving patients around the building, now nurses and other staff can spend more time on patient care services and more time to improve the patient experience. And we can be more efficient. And later, we'll go through some of the, you'll be able to see how the whole surgery process will be more efficient in terms of drop-off at the main entrance and private exit rather than patients having to go through the lobby on discharge like they need to today. We're also working on safety and efficiency and the patient-family experience as we design the new patient rooms. We're incorporating what's referred to as a standardized same-handed rooms, so all of our patient rooms will be set up exactly the same way. The left on one room will be the left on others, so in an emergency, this can make a big difference in terms of patient safety. Staff will know that every supply or knob or clinical piece of equipment will be in the same spot in every room. Historically, hospitals have been built as mirror images, so they're left-handed rooms and right-handed rooms, so people need even that half second of thinking, where am I, can make a difference. And there have been a lot more research on evidence-based healing and how how the physical plan can support patient safety and the healing process, and we've incorporated the latest research into this facility. We also have, in terms of designing the room, areas for patient, let's see, kind of the nursing area, the patient area, and then a family space or zones. And in fact, in our patient rooms, we've had the ability, we have mock patient rooms outside the cafeteria, and you're all welcome to take a look at them if you're in the hospital. It's just in the hallway across from the cafeteria. They're not all finished up, but the walls are set up. And we've had staff testing the rooms, looking at sight lines, angles, moving equipment in and out. So we've done many tests and then tinkering and fixing and adjusting the space before we actually build the space. So we're been very appreciative to have that opportunity, because it's not often you sort of get to kick the tires before you actually build the building. To make sure we didn't miss anything, we've included the community and our staff in the planning process. There have been more than 4,000 hours of planning on the part of our physicians, management team, and frontline staff to attempt to find every way possible to deliver care as efficiently and as affordable as possible and continue to maintain high clinical outcomes and patient satisfaction. And as we move into the presentation, you'll hear comments more on evidence-based design and how we've tried to develop the building to support the healing process. We've also held focus groups in the community so we could hear from the community what people want in the new building and what people thought maybe isn't needed. We've also continued to meet on a regular basis with our neighbors adjacent to the campus so that we can get their input in terms of how some of the changes we're making are affecting the neighborhood. We understand that change isn't always easy, and healthcare is a very fast-changing industry. When we studied the need for this project and this investment, we came to realize we had only two choices: either to move ahead and keep pace with the rapidly changing world of healthcare or be left behind. Here at Monroe Clinic, indeed all of us in this community are guardians of the healing legacy started by the Sisters of St. Agnes and the founding physicians of Monroe Clinic. By moving ahead with this project, we continue our mission of working together to achieve the highest standards in healthcare and creating healthy communities through God's healing spirit. That's what we feel is so important in terms of connecting this facility and this investment to our mission.